So the mapping the treatment plans, it's everything if you want to become a high-performing private practice therapist, because the 4 questions that every patient wants answers to when they come through the door is, what's the problem? Why did it happen? What's the plan? And how long realistically is this going to take? And if you can't answer those 4 questions, then you're not meeting the patient's expectations in the first session. And then it's an uphill battle from there. What the treatment plan does is it gives the patient certainty that there's a plan and process. It immediately calms them, and it's a massive therapeutic effect as well. It also gives the therapist confidence and guidance, because then that becomes the North Star. So every single session there's a plan, and the therapist can focus on using the right techniques at the right time.
So yeah, really exciting day today. We've got 2 new physios starting with us today, Hannah and Alex. Obviously they've been through the interview process and they were the successful applicants. So really looking forward to the onboarding today.
Hi, I'm Hannah. I didn't really know what I wanted to do. I always wanted to be a teacher, and then decided that's not for me. So it was a kind of rush for time to see what I wanted to do. And then my sister played rugby professionally. My dad always played rugby, and then she got injured. She got an ACL injury, and she did physio, and she came back and she was just telling me how much she enjoyed it, and like all the rehab and stuff like that. And just ended up quite enjoying that, and then did a bit more research around it, and then actually really fell into it as I went into college and stuff like that.
So my name is Alex Taylor, and I just wanted to become a physiotherapist just based on sort of the results you get from helping people and kind of that uplift you get when you see somebody doing a lot better than they were when they first came and saw you.
I was a bit nervous before I came in, but then obviously I had my interview here, met a few people then, spoke to a few people on the phone, and then once I came in, everyone was like really welcoming, so it was quite nice actually. So it settled all the nerves straight away. The fact that they've just given a plan for not just today, not just tomorrow, for the next couple of weeks for us both, just shows the level of planning they've done just for us. And then even just down to all this, it's just seems so professional and so planned. And we've just had a meeting about their kind of vision, which is all really nice as well to see where they've come from to where they're wanting to go to. It just seems nice and structured, really.
It kind of threw us in the deep end of sort of learning straight away, which I prefer that way, because it gets you going straight away rather than sitting and feeling like you're not doing an awful lot. I'm enjoying sort of where it's going and whatever. There's a lot to learn, and one of the first things we got told were forget everything you learned at uni. I like the way that kind of this company and Dave specifically does things. He goes a lot more patient-centered rather than this is the problem, deal with that. You deal with sort of the patient and what they want to do, which is, I think, the right way to do physiotherapy. So
the therapist mentorship does 80% of the heavy lifting for our clinic and other clinic owners, because it's got everything that therapists need in order to be successful in private practice. So we've got the initial assessment structure, we've got follow-up structures, we've got all of the hands-on techniques that they need, early stage rehab, end stage return to play field. It's got everything they need from a clinical point of view. Now, the beauty of the therapist mentorship is that you can keep your treatment autonomy, because first and foremost what we teach is a way to take in a systematic structure to take all your knowledge and organize it in a way that allows you to use your techniques at the right time.
I think a lot of time when people come in and they go through an onboarding process, there's just loads and loads of information being thrown at them. So they have to learn all these techniques, learn all these procedures, etc. And I think the big thing for us, and we had this conversation this morning when we talked about the vision, is I'd rather them get the actions right first and just go through some of the role plays and just go through some of the scenarios. Even if that means they don't really understand it all yet, I think the first step is to just go through the process and role play a lot of scenarios. And then, like I said, the understanding comes with practice. So I think the biggest difference is we're not going to sit down for 2 days and just go through lots of information. We're straight away into some role play scenarios and into some practicing of skills rather than just going through theory.
Yes, patients drop off before completing the treatment plan for a number of reasons. And I suppose you could invert that question and say, well, why would a patient follow a treatment plan and go the full course? And in order for somebody to, first of all, buy into a treatment plan, they need certainty in 3 different areas. They need certainty in the therapist that they can help them. They need certainty in the actual plan is going to get them to their destination. And then they need certainty in themselves that they'll actually be able to do the plan and get the result. And that's really where, as you can see from that, the treatment plan is the most important piece of the puzzle, because that treatment plan gives the patient confidence that makes it feel not overwhelming, where it's like, here's where I am, here's where I need to get to, but we can chunk it down into bite-sized chunks that makes it feel more achievable. And if we don't have that treatment plan, that's very, very often where patients, they don't know how far they've gone, they don't know how close they are to the destination, and naturally their attention wanders because something else gets in the way, which is ultimately called life.
I think it's what's your understanding of why we do this rather than just read it from the pre-assessment form.
So we can like visualise this when we do the other one, like
Yeah.
the next part B.
Yeah, exactly. So they can visualize it, but also for us as well, we can really look. It's obviously fairly straightforward in this example because there's not that much history, but if there's a lot of history there, we can actually look at it and start to make sense of it. Right, where are the clues here in the story of what's led to what? That's put them in the current situation. Whereas when it's just a wall of text on the screen, it's sometimes hard to piece that information together. And your right hand side of the V then is going to be the goals.
This isn't as nice a pen. Love
Patient specific.
Yeah. Then we could do, if it's paid for at work, then sitting at a desk comfortably.
Yeah.
I can't give an effective explanation for this. Because I know, like, I'm after there, like, I know it's that to that. And then I'm lost.
The bit that's confusing me, knew coming into it that they had very high standards from the interview process. But I'd say surprise is how different it was to what we got taught at uni. I'd say that's the thing that kind of moved me the most surprised, if anything.
Yeah, the mentorship is really important. It's so important. It saves so much time. So even before they came in today, they've gone through the initial assessment mastery module, so they know the process. So it's not the first time, and we talk a lot about, you hear something for the first time, that's the first step. Then you know it because you've gone through it a few times, and then you get to the stage of you really understand it. So what the mentorship does is it gives them the structure and it gives them the system first. Then they come into the scenarios and they will play it together and they start to know it and they start to know the process. And then later on, then when we do the teaching and we start delving a little bit deeper, they get to really understand it.
Yeah, so one of the big problems in university and even in the NHS is we don't acquire the skills to develop treatment plans. And I was very fortunate in professional sport where you have to have a plan. And when I worked with Eddie Jones with England Rugby Union, he demanded a physical copy of the plan. Now, whether he looked at the plan or not was neither here nor there, but he just wanted to know there was a plan. So what that required me to do is, okay, this player is going to be out for 6 weeks. What is his actual plan? So working in professional sport gave me the exposure to develop the skills to map out treatment plans. But for the vast majority of therapists, they don't get exposure to having to think long term. And a lot of therapists, as a result, then they just wing it session to session. And if they wing it session to session, they're not clear on the next step, which definitely means the patient isn't clear. And if the patient isn't clear on the next step or what progress looks like, then naturally they tend to drop off.
I don't think we're miles off it.
Yeah.
It's the connecting the dots.
Yeah.
So then because we're connecting the dots, we can't be doing the diagram.
100%, yeah. That's why I want you to do it yourself. And I know this is clunky and I know it's a bit tedious, but today is really all about initial assessment mastery. So there's 4 questions we need to answer in the initial assessment. So the 4 ProSport, I'm not remembering the question. 4 ProSport questions. Can anyone remember what they are?
What they are goals?
No, but that is important. If someone comes in to you and says, I've got back pain. What do you think? What goes through your head?
What we do when this back thing came on.
Yeah, exactly, perfect. So the first place I want to go is also check if you just sit, put your feet flat on the floor, Hannah, and you just bend down and reach down to the floor, so I can check seated flexion here as well. So your hamstring's not involved in this movement. If your pain was coming on still there, I'm probably going to have to spend a bit of time on the 20% of symptoms today. Does that make sense? So from day one today, one of the big things we said this morning was they need to understand the actions that they need to take. And again, even if they're not perfect at the start, if they understand the actions they need to do in terms of, I need to map out a treatment plan for every single patient. I need to explain the treatment plan to every single patient.
From picking your baby out of the cot. Obviously, if you're looking at your previous injuries, the C-section probably affected your abdominal muscles, and obviously you've had low back pain before, so clearly this has been an ongoing issue.
So, and then the hinge and the added weight before you get back to the full deadlift, I'd say maybe another 2. So then before I get back to deadlifting at full capacity, I'd say possibly like 6 to 7 sessions. Yeah, cool.
Doesn't matter how good the therapist treatment is, it doesn't matter how good their rehab is, it doesn't matter how good their techniques are. If the patient doesn't buy into the treatment plan, we're going to run into problems. So day 1 today, they need to understand the actions they need to take in the treatment room to make sure the patient understands the treatment plan, and everything then follows on from that. So Hannah, feedback to Alex, what can we do better? What did you do well first of all? Let's start with the positives. So what did Alex do really well there?
He explained like how the previous injuries could like relate to this specifically to your condition.
Obviously, Shane and Dave have sort of took a chance on me and Hannah when you don't want to let them down. But at the same time, I feel like I do thrive under pressure. So I feel like a lot of responsibility, but hopefully the positive kind.
So we hire people on the core values. So if we get to today and the therapist doesn't buy into it or there's some mismatch, again, I would say that's probably a problem in the hiring process. And we've definitely had that in the past before to some extent, but I think now our hiring process is a lot more robust. So I'm not expecting that today. I'm expecting them, because we fired them on the core values, I'm expecting them to really excel in this environment now and push forwards. Fingertips, and I'm trying to lift her head off the bed and relax for a second. I'm bringing her in this range rather than straight up to the ceiling like that. I don't want to put like a shear through her neck, so I'm trying to almost tuck her chin back down again. Put my hand on her forehead and then don't let me pull you down, Hannah. Stay, keep your head there, and I'm going to try and untuck. You're a little positive there, a lot of people are. And then sternocleidomastoid, which is what we're talking about. So it's going to rotate to the opposite side and side flex to the same side. So I'm going to rotate Hannah this way, and then I'm going to get it to push into my hand here, and I'm going to try. Savannah's actually a little positive there. We'll check the other side. Yeah, Emily, let her press first. You don't do anything first, and then you start to build your tension. Good. Looks good.
Let's go, spin.
Does that feel similar, Alex?
Yeah,
cool. So we've just finished day 1 of onboarding. Went really well, actually. Like I said, it's a little bit of a different structure to what we normally do. There was a lot more group work where we had 2 physios starting together. So they had a lot of group work where they were working together. And I wasn't sure how that was going to go, but actually worked really, really well. So what we did was we gave them a clear definition of what they were going to do in that time together, and they did a great job. By the time it came to the role play in the afternoon, they had already come a long way in regards to understanding the actions they need to take. So the main thing today was nailing the initial assessment, and by the end of today, I'm confident that they're able to use the V to piece the clues together. They're able to do a solid, effective explanation. Tomorrow now with Ollie, they're going to take those same scenarios, but they're going to look at what are the next stages. So how do I do my objective assessment? What am I going to do from a hands-on perspective? And where am I going to go early stage rehab wise? So by the end of this week, by the end of these 2 days, they should be confident in terms of all of the skills they need for the initial assessment. And then the nice thing is then everything we've gone through is in the mentorship content for them to go away and practice over the course of the week before they come back in.
What would confidence look like for you at the end of this journey?
Just being confident that I can get that every patient that comes to see me will be leaving satisfied, and will be able to go home and speak to the partner or whatever and know what they're doing and can see the path of how they're going to get to where they should be.
Having the confidence to say like, no, I actually do know what I'm doing. Like going into it, like getting new patients, stuff like that, it might be a bit like scary because I might get a patient in that's had something that I've never dealt with before. Whereas down the line, hopefully I'll have had a lot of different variety of kind of patients and injuries and different conditions coming in. So kind of, even if there's something I've not had before, like them being able to kind of relate to something else, like that is confidence in itself, I'd say.
Yeah. So what do you see there? It's a really deep muscle. So what do you see about the attachments for it? Good. Nice. Relax. Anything else to look up?
Yeah.
Yeah, you probably you're almost like clawing with your finger a little bit.
Mm-hmm.
All right. Yeah. So do a couple of reps on it. You try and figure out.